Yeah, sir. I think YouTube Live is also started.
All right.
Uh, yes, yes. 1 second, sir. I'll check the. Think. Yes, sir. Yes, sir. Yeah. We are all good to go, sir. Firstly, thank you very much for coming on a short note, sir. Uh, Hi, hello everyone
Thank you.
to all the Dr. JTM subscribers and viewers. Today we are going to have a live session with Dr. Jagdish Chaturvedi, sir, who is a renowned ENT surgeon, innovator, entrepreneur, a lot of qualities. Thank you so much, sir, for being here. And we'll be discussing about
Thanks, Arun.
the next 60 days, 60-day odd plan for NEET PG aspirants, how they should move forward from here on, because the next 2 months will be very critical for them, and many of them might be getting into the proper preparation right now, starting their grand tests and all. So for them, I have written few questions, and also we'll take few questions from them also. The live chat is open, so they can also ask the questions in the live chat. So, sir, I wanted you to say hi to my subscribers and also the viewers here. So we'll start the session.
Hi everyone. Sorry, I just came out from my clinic, my OPD, so I am dressed like this, but I have found a good place to be seated in my car. So this is like the best studio, but I hope you can hear me well. And I would like to thank Doctor over here to get me so that I can interact with you. And I'm happy to answer all of your questions. And nothing to worry about. I think a lot of you take a lot of stress for these exams, but I think if you understand the trend of the exam and how these questions are going to be asked, which I can give you a lot of insights on, you'll be able to prepare for it better.
Exactly, exactly. That would be real great help for all the aspirants who are preparing, sir. So, sir, I wanted to get into the questions
Yeah.
without any delay. So, my first question is, what should be the approach of a PG aspirants right from now, because it's just 2 months, 60 days left, and how should they approach?
Yeah, so one thing is, I hope everyone has understood by now that the questions are turning more clinical. And right from the board and the kind of questions that have been asked over the last 3 to 4 years, if you notice the number of image based questions, you notice the number of clinical vignettes and the number of clinical based application questions are increasing. And in this upcoming NEET PG or INICET or FMG, whichever exam you're preparing for, you can expect a lot of clinical application based question. So one of the things that you need to do, I'm sure you already have got your basics right. You've already been preparing, you either through notes or some of the other online platform or through PW MedEd or from your colleges. You need to now re-look at every important point in your preparation and see what way can this be asked clinically.
Exactly.
And if there is a potential for an image that can come in that point, and if you are able to make that extra layer of notes, you will be a little bit better prepared, because in textbooks and in most of the teaching platforms, they are not that visual. They are more verbal, and you may be having a lot of heavy text. But clinically, things are quite different, and you may have missed a lot of your clinical, postings because you're preparing. And also, when you take your, backs and you're studying, you're not exposed to the clinical world. The same science and the same basic questions can present very
Exactly.
differently in a clinical scenario, and that is where now examiners are trying to address an issue that students who are clearing these exams and entering into PG have very good theoretical knowledge, but they are not designed to clinically think, and that is a concern that the National Board of Examination is trying to address. And one of the advisors also contribute to questions, and one of the things that we have been asked asked when we are submitting questions to various question banks is to give clinical questions and submit images to their library.
Yes.
And that's why you can expect a lot of clinical images, microbiological images, pathological specimens, audiograms, and lesions, anything that is visual. You should be able to see those and be able to identify those, as well as think of every point which can be asked clinically. It's a broad answer, but I can give you some examples as we discuss further.
Yes, 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 sir. That exactly right. Because with the change in the time, with the change in the year, they are changing the patterns of the questions very, very vigorously, I should
Yeah.
say. And the student should adapt to it from time to time. And how far is it true that 80% of the questions are coming clinical and totally the fact based or one liners are completely being removed? So how can they actually grab the concept clinically instead of mugging up or memorizing, trying to memorize the facts which are not much useful to students?
Yeah, this is a tricky one, Doc, because the thing is, the clinical application only a clinician knows, and the students don't interact much with their clinicians or professors or assistant professors. Or best is a senior resident or a PG who understands that. Maybe what you can do, what we are doing actively in PW Meded. If you're studying for PW Meded, you're pretty much sorted, because what we are all actively doing is, while we are teaching, even in our live sessions and even in our recorded videos, is every point we're telling how can this be twisted and asked clinically. And we come from clinical backgrounds, actively practicing. I just came out from my OPD, so we can see, okay, when I see this patient and this is the image, but I know this is the basic anatomical question that can be asked, right? So it is fairly true that to assume that 70 to 80% of the questions can be clinically asked, but the direct application questions may be roughly 50%. 30% can be pseudo clinical, where they will give you a clinical history, but the last line will be one random line just to make it clinical, and you may end up wasting your time
Yes.
when you're trying to answer that. They may say patient has this problem, there is a big swelling, which pharyngeal arch it arises from, and that you can answer even if you read the last line.
Yeah.
And I think many students follow the policy of reading the last line first and then decide if you need to read the entire paragraph.
Exactly.
But 20-30% questions can be like that, and out of those 50% clinical questions, I'm very sure that a good 30% of those will just be direct image based spotter like
Yes.
questions. And that is what I think students are least exposed to.
Yes.
And that I think can only come when you start spending some time in the clinics or with the clinician. And I think that is the whole idea of the medical fraternity, is trying to push students to change that trend from bookish knowledge to a little bit more clinical knowledge.
Exactly, exactly. That's really true, sir. So with that point, how should they actually plan their revisions from here on? Because many of them might have completed their first reading by now, and they might be planning to do 2, 3 revisions, and they're not very much clear how many revisions will actually give them a seat. So what would you say?
Yeah, I think what you should do is, I'm assuming all of you have a good notes by now, either self-written or taken up from somewhere else, right? So I'm assuming 60 days before your exams, you have at least one set of notes ready. So when now you're revising, I can just say from ENT standpoint, like even if you are, let's say, starting with embryology, and you're looking at pharyngeal arches, then you know that, okay, a branchial cyst is a question that is asked. Then at least look up online on the internet what a branchial cyst looks like, and try to grasp that image, because that branchial cyst can sometimes also look like a submandibular a gland infection. It can also look like a lymph node. It can also look like a Zenker's diverticulum. It could also look like a laryngocele. It can look like many things. So what you'll have to do is try to see if you can get that image printed out and put next to your notes of all the various differential diagnosis of any particular condition. So what I'm trying to say is, when you are revising, try to see where all in the notes already people would have taught you these diseases, but you don't know what they look like. So try to get those images and the differential diagnosis of these images. Like I can tell you from last year's NEET PG question, they showed an image of the tongue, which was white color with hair coming out, and they said, what is the differential diagnosis of membranous lesions, and it was hairy cell leukoplakia. But you may be reading about, candidiasis or diphtheria, but if you look at images of all the differential diagnosis, any of the differential diagnosis can help you in either answer of exclusion, or it will help you point out the diagnosis. So when you are revising, to answer your question, go through each point and see where there is a potential for image Google it. Nowadays, everything is available online. You can get a lot of images. Try to see if you can get a quick printout or a way that you can revise those images. If you have a soft copy, put that image in your notes there itself, saying that this is what the differential diagnosis of a branchial cyst would look like. And branchial cyst is coming from embryology. So imagine if I go like this to entire ENT, you'll easily have 50 to 100 images for you to revise. And those will help you save a lot of time and reduce confusion and gain some important marks in your exams.
Yes, yes, very, very true, sir. So the students, so far they might have completed their classes, might have done their first readings, and with regards to revision, they had a mild confusion whether to go the systemic approach of revisions or subject-wise approach of revision. So, like you said, now we need to correlate from embryology part of the anatomy and also the ENT clinical aspect. So, which is the proper way for revision? Like you said, is it better to go the system-wise approach or better to go with the no subject wise approach?
I would recommend subject-wise approach because there will be a lot of overlaps. But subject-wise, if you go from embryology, anatomy, and ear, nose, throat like that, you would have studied in that same way, and you're adding layers of information which are now clinical correlated in that same way. It will be easier for you to recollect
Yes.
rather than now just going system-wise and then trying to plug and fit everything. There are chances of missing things out. At least if you go in an order which you've already studied and you're adding layers to that, it still becomes easier for you to recollect and follow a particular pattern. And in 60 days, I wouldn't want to change too much of your approach. And for
Exactly.
that reason, I would say follow subject wise and go from basic embryology anatomy to physiology, and then do clinical diseases. And as much as possible in the anatomy and the non-clinical aspects, try to see where a clinical link will be given, because as someone who's been in this field, that is favorite for examiners. Where you least expect a clinical correlation, that is where they want to test your knowledge.
Yes.
Now CSOM and all of these other clinical diseases, already it is clinical and there are a lot of presentation images and all of that. So they know that more likely students would have prepared. But if you take something that is not related directly clinically and you pull it out from that, students wouldn't have prepared, and those kind of questions are likely to come.
Yes, but that's really a great point from Dr. Jagdish sir, because many people are very much confused. They're going with half revision systemic and half revision subject wise. By the time they realize which to remember and how to remember, they are forgetting everything. So, sir, like many people, like they have completed the classes and also started their revisions, they're yet to practice MCQs. So, how do you suggest practicing new MCQs or practicing the old MCQs repeatedly, which would be more better, and how many MCQs do they really have to practice before NEET PG 2023? Sorry, 2024.
Last 5 years, PYQs are a must, and by statistics, it is tested beyond doubt. 15 to 20% of questions, at least in ENT, I can very confidently say will be repeated from PYQs. Same concept twisted in 2 to 3 different ways, and you can study the last 2 3 years papers and see how much of it has come from previous years. There are 8 to 12 ENT questions, and you'll easily see 3 or 4 that are repeats over the last 5 years PYQs. So after you have done your notes and revisions and you're going towards MCQs, 5 years of past year questions, I think you should go through in detail of all subjects, and that itself will take care of, I think, easily 25-30% of the questions, if not more,
Yes.
that are going to be asked. Because remember, these are computer selected questions. It is not like an individual is picking it, so the same database is there, and many times the same question, each question can be written in 4 or 5 different ways, and that is also added into the pool.
Yes.
So remember that it is coming out in a particular algorithm to come out as a question paper for you. So I would easily say 20 to 30%, but it has always been more than this of past year questions. Now for your mock tests, PW Meded is taking special efforts to give you clinically oriented mock tests. We are also now thinking from the trend and change and trying to give you mock tests and grant tests that are more clinically oriented. Now, the problem is if you are going through mock tests and grant tests that are still little old fashioned, you may not be preparing for the trend. Okay, you may still be answering a lot of theoretical questions, and you may go away thinking that you're doing very well. So, and the problem is that copyright-free clinical images are very little
Yes.
out there, right? Which many times examiners and exams cannot use. So, we are taking active efforts in PW Meded. Is I myself am submitting a lot of our ear, nose, and throat and clinical images, and similarly, other doctors are doing it. But the source of copyright-free clinical images are going to come from clinicians.
Yes.
So either spend time with clinicians, maybe even if it is 1 hour in a week, sit with a doctor that is known to you and start seeing some clinical images in areas where you find confusion. Don't have
Yes.
to go and see in areas where you have no confusion. Lots is available online, but there may be areas where you say, "Yeah, I don't understand this area at all."
Hmm.
Try to talk to that clinician and say, "Sir or ma'am, what is it that this looks like, and do you have any images with you or any clinical presentation of a patient?" Clinical, granted course.
Okay, okay, that's really great insight, sir. And one question that students wants to know: should they start practicing grand tests right now, or should they wait one more month and then practice in the last month? What is your view on practicing grand tests? Because many people haven't started grand tests at all.
Yeah, I would recommend that for 60 days before, once a week, grand test or a mock test is important. See, the reason is that sometimes when we are preparing, there is a chance that you may just deviate into a particular area and just linger over there, or you may not know where to circle back.
Hmm.
A grand test weekly, what it does is there may be things that you would have missed out, or while you are doing your revisions and preparations, you may realize that, oh, this question is being asked, I missed it in the last grand test. Now you have found the answer to it, so now that you will tag that and you will remember it, rather than first doing the study and then last moment doing more grand tests.
Yes.
You may end up being a little underconfident towards the end if you don't do well in those grand tests. But if you do one grand test every week at least, while you are preparing, you will start tagging answers to the things where you went wrong,
Yes.
and it will constantly keep you in check also with your preparation, that okay, now you are beginning to see the trend. See, it's very important to see the trend to understand how to design your revision. And trend can only happen when you start doing something repeatedly over a period of time, rather than doing last minute and panicking if it doesn't go well.
Yes. Yes. And should they only stick to one platform for practicing grand tests, or they can involve themselves in different
Yeah.
platforms in practicing grand tests?
Yeah, I think grant is more variety, the better.
Yes.
Just more variety from different sources so that the biases are removed and you get exposed to everything. Will give you a better overall preparation, and it'll also give you a reality check every week
Hmm.
as to where you're going. Or if not, at least your revisions will be more directed because you will know where you went wrong in the grant test and what your strengths are.
Yes, and many students were very commonly asking me, after doing one grand test, definitely they'll be not getting 600 700 out of 800, and they'll be getting somewhere around 300 350, and they get panicked and they stop doing grand test because they're getting low marks. So can they really correlate their marks which they are getting right now to their final scores in the exam, NEET exam?
Yeah, see, I think the purpose of the grant test is not to see how well you're doing. The purpose of the grant test is the weaknesses of your own self are different,
Yes,
right? So
exactly.
if there are those 300 marks or 400 marks that you're missing out on, when we realize an error, we kind of become a little more driven to find the answer to it because it's concerning to you. Well, what it will do is that okay, the ones you're getting right, you won't be too bothered about it. But the ones you're not figuring it out, you will be like, yeah, arey, what is the answer for this? And when you are doing your revision and preparation, you will have those aha moments or those clarity moments, or at least areas where you can then say, oh, this is where I went wrong. And next grand test, if something like that comes, you will be able to implement it. But you will identify newer areas where you're not good at. And in your revision, you will be able to find the answers to those. So I think grand tests kind of dictate the direction of what you are studying in your revision. Otherwise, it's very vast.
True.
Where do you go? A good starting point is to go from what you went wrong in your grand test and then expand it to other areas and use it for that purpose. Don't equate grand tests or mock tests as a reflection of the actual test, because trust me, even most people who are teaching and training for this are going to be surprised with the change in trend. So do not go by what has happened in the past. The
Yes.
change is happening much more stronger and much more drastic than what it was before. Use the grand test only to strengthen your weaknesses and areas where you're getting things wrong.
Yes. So
Don't
all
derive a conclusion from it. Yeah.
Yes, exactly. So all the aspirants take this point into your mind and keep practicing grand tests instead of just stopping in the middle. So, sir, apart from this, how can the aspirants right now till their NEET PG exam, how can they make use of PW method either for anything, either for the people who wants to qualify or people who wants to do better revisions? How can they actually make use of it? What sources and material that is available with PW method?
Yeah. We have the ASAP batch, we have a rapid revision, and we have a PYQ Q bank that has been very well curated and validated and verified, which will help you do some very quick revisions. In fact, like if you look at the ENT rapid revision, I think, generally a 30 hour, 35 hours of ENT is crunched into 3.5 hours. But it gives you all the quick rapid points to revise. So even if you sit at a stretch for 3 hours, and I think many other subjects also have in 8 to 10 hours, they are longer subjects, so they cover the rapid revision, at least the most important points. Let's say 70% of it you get covered by it. Rest do the PYQs, and plus we have our own curated question bank, which I think have thousands and thousands of questions that you can go through, and also then you can do the grand tests or the mock tests on a weekly basis. You can also attend the upcoming live sessions. So we are doing live sessions every week,
Okay.
and though these live sessions are basic for the professional exam students, but we are actively doing this linking of basic things to clinical application questions. So while you might find that as a revision, but at least you will see a little bit of a clinical application based in our current live discussions, and of course our notes. So I think all everything that PW Medit is doing is very actively and very I would say proactively gearing towards the new trend and giving you all that information that you need.
Yes, so the students who wants to make use of PW method, you can opt this material right now and make use of for the next 2 months, and maybe you will be fetching more marks for your final exam. Sir, I wanted you to tell few study tips for the students regarding how they can approach for END as a subject for NEET PG exam.
Yeah, I think ENT studies, I think this time and also going forward, you have to go very concept based. Now, the problem with concept based studying is it is not going to be very fast because you have to go a little deeper into the concept, because the style of questions that are going to be asked are testing a concept. Now, I'll give you an example, okay? Just say one ENT example I'll give you. You know about the inner hair cells and the outer hair cells, right? These are inner ear hair cells. Now, if you read in anybody's notes, they will say, the potassium channels open in the inner ear hair cells, right? And you may just, read that somewhere or make a note and revise it. But the examiner can ask you a question like saying that in the inner ear cells, which are the kind of hair cells where the potassium channels open for action potential generation, and they'll give you option inner ear hair cells, outer ear hair cells, both or none. Now, here you have a little bit of a gap. You have not clearly read anywhere about outer hair cells being involved in potassium channel. So you will most likely say both, right? That will be your guess. Or you may say that, outer hair cells, or because that is a more popular one.
Yes.
Or you may be a little unsure. But thing is, if you go into the concept basis, you will realize that outer ear hair cells are actually not participating in hearing directly. They are actually a type of supporting hair cells. And when the tectorial plate touches that, it releases a protein called prestin that causes it to become short. And when it becomes short, the height comes down, and then the inner ear hair cell touches the tectorial plate and potassium opens. Now, this is a concept level learning of that same topic. It might take 10-15 minutes extra for you.
Yes.
But when a question is asked like this, you will be 100% clear that only the inner ear hair cells participate in potassium channel influx, not the outer ear hair cells, because they only work with prestin activation. So sometimes we become very impatient and we want to cover the portions quickly. And that gives us mental peace. It's a very pseudo psychological peace
Yes.
that, okay, I just want to read the point. Don't give me any bakwas. I don't want these stories. I don't want to even do ENT. Why should I go into this depth? But what you need to understand, my friends, is the questions that are going to be asked are going to test your concept basics.
Yes.
And for that concept basics, you have to dwell deeper. And that is what will differentiate between someone who gets in and someone who doesn't. Such a simple thing as inner hair cells and outer hair cells. But if you don't understand the concept of prestin protein, you don't understand the concept of one cell is shrinking so that the other one is touching, you are going to miss such a simple question, or you may just get lucky and guess it out, right? So every here your studies have to understand the underlying concept of it such a way that even if the examiner twists it, you should be able to pick it out. Otherwise, you're going to make silly mistakes and lose out on an important opportunity.
Yes, so it's not just for the ENT, but the similar method you can apply for
Yeah.
any subject, which will actually give you a lot of insight on the concept, and you can answer many MCQs, whatever pattern they might ask. So, sir, and so what about those NEET aspirants who have started their preparation for 2025 NEET PG? So how should they approach? How should they take this 2024 exam in between, and how should they move forward for 2025 NEET PG exam?
I think 2025 is going to be next, right?
Yeah, hopefully.
So, so if 2025 is next, then you're going to have 60 questions from ENT. But what I understand in the difference in these 60 questions versus the 8 or 10 questions that come in NEET PG is that those 60 questions are going to be extremely basic and concept based. They're not going to be all or above, not all except, they're not trying to confuse you. The purpose of next is to test your basic knowledge. So even though questions are going to be more, they're going to be very fundamental. They're going to be testing whether this person has a sound understanding of basic clinical thing. When you're examining the ear, patient faints, oh, the Arnold's nerve is involved. This student knows that. Okay, this is, the foot plate of stapes originates from one place, the suprastructure originates from the arches. He or she understands that basic thing. That is how those questions are going to be designed. I don't think, regardless of whether next or NEET PG or whatever format comes, your approach of clinical application and concept based teaching should not change, and that is not going to affect your exams at all. What you should not do is pure blind mug up. That is not going to work anymore, guys, and that is the reason why this change is being made from the National Board of Examination. And I'll give you a little secret in confidentiality. Some of the people senior up in the in the National Board are known to me, and we were at a conference, and they were very upset that the current students, they have knowledge, but they are like, if I am ever, like one of the senior doctors was telling, if I am ever ill, I don't want to be treated by these students. They have theoretical knowledge, they have mugged up knowledge, they have no application for even basic things. Are we getting the right caliber of doctors in our country? They have taken that as a moral responsibility and made these changes, and you need to understand that whether it is good or whether it is bad, the idea is to get people who have an aptitude for medicine, who are able to think like a doctor, who are able to think like a clinician. So these patterns are all geared towards any student who has good basics of clinics and can think like a doctor will do well in whatever format of exams. But if you think that I just need to crack PG, I just need to get this seat, I need to earn 5 crore, I don't care about anything, I'm gonna maga, those students are going to suffer because the patterns are changing, which are not favorable for those kind of students. And that is how people have been cracking exams 10 years ago.
Yes.
And that is what the National Board is trying to change.
Yes.
Don't blindly mug up for the sake of just getting into PG.
Yes.
You are a doctor, you have to like the field, you have to have an aptitude for it. You should ask questions. What else is there? Not because it's an exam important, it's because you as a doctor need to know where at the end of the day you will be sitting in front of a patient, and that patient is not going to be lenient like your exams. That patient will make you a patient if you are not able to treat them properly.
Yes, yes, very, very true, sir. Like the students who have been adapting to new pattern of questions, they need to adapt to the new pattern of exam from next year. Probably the
Yeah.
next exam will be there. So all students, they should change their approach, how they have to study for this next exam. And many videos or insights will be coming from Dr. Jagdish sir in future regarding
Yeah.
next exam for sure. And I think you will be the most happiest person if 60 MCQs are coming from ENT in next exam.
Well, the chairman or the director of National Board was an ENT, and I think they took it personally that the students are not respecting ENT. They say it's a honeymoon subject and all of that. But regardless, I'm not like happy or pleased. But I think as a doctor, regardless of your field that you choose, you will be seeing patients with ENT problems in your life. Yeah, even if you are a urologist and you are on the opposite pole, you will have one relative who will say naak band ho gaya hai, saans nahi le pa raha. That is going to happen to you. So every doctor should know basic ENT, and I'm not saying that because I'm an ENT surgeon. I'm just saying that because that is the entry point of every human being.
Yes.
And basic ear, nose, throat problems are there with everyone, including yourself and your family.
Yes.
So I think that is why ENT and ophthalmology have been given that little extra pedestal of importance because they are important clinically.
Yes.
And that's why there are more questions in it. And I think that's the right thing. People should know about it and not just assume that "Arey, say only 10 questions come and I don't want to focus on this. I want to become a radiologist. I will only see films. So that
True.
too, the blue color X-ray one. So
True, sir. So we'll take few questions from the viewers, maybe for next 5 minutes only. But
sure.
before they can put up their questions in the chat box, I wanted you to put up some points on students' mental health, because that's been very important issue they are facing. They might not be talking to anyone during this preparation. So what would you tell them?
Yeah, see, this is again, okay, this is a personal view. I'm not saying this from being a faculty in PW Meded or anything. I'm just saying this as a personal human being who's a doctor. Guys, you must understand our healthcare system is not designed for every doctor to be a specialist. Nowhere in the world, every doctor who passes out has to be a specialist is a norm. Nowhere less than 5% or 10% of the doctor pool choose to be specialists, and that is what is required for any healthcare community.
Mm.
Unfortunately, even though in our country we train far more doctors and we have less number of post graduation seats, is primarily because that is how every healthcare system should be designed. But our so-called motivators and drivers basically try to sell this false dream that every doctor can become a specialist, and that is impossible from the structure of the healthcare ecosystem. Not at all. We train lakhs and lakhs of medical students every year, and there are just a few hundred or few thousand post graduation seats. Not everyone is going to get into PG. You take 5 year back, 10 year back, it is not a game that is worth it.
Yeah.
Try it once. That is not the end of your medical career, and you need to realize that the outside world for a doctor is a far more lucrative and a far more gratifying field rather than what you think about. I need to get, otherwise I am a nobody. So for your mental health, this thought process is important. I'm not saying do not do well, do not try hard for your post graduation. I'm trying to say is that if you think that that is the only way, you are setting yourself up to a very impossible task, and you are setting up yourself to a lot of mental stress and a lot of unrealistic goals. Every If you are interested in the field, you should definitely try to do post graduation. If you don't get it in 1 year, I don't think it is worth spending your life in that. There are a lot of other fellowships, certifications, and other ways for you to pursue that field and still do in it. Remember, you should be interested. You should not take it because your parents want to. You should not take it because you will not get married. You should not take it because it is a society or status symbol. Those are all not true. You should take a super specialization or specialization purely if you're interested in that field. Otherwise you will end up quitting that field and paying a hefty bond, and then or probably hurting yourself, which we have seen happen numerous times. And that is important for your mental health. And people like me are always there. Even if you don't get in, we have a lot of ways to make sure that you contribute as a doctor, make patients' life better as well as yours. So don't worry about that and take
Yes.
care of that thought process.
Yes, not only just putting one thing in your brain that you had got to crack NEET PG, you need to keep your mind open, that you have multiple options, then prepare. Eventually you find a good rank, and eventually you find a good seat in a good college. But making yourself thinking that only I wanted this, I have to crack it just because everyone are cracking it, will not help you. So this is a very good point by you, sir. Thank you so much for talking on this mental health for NEET PG aspirants. Sir, so one question that's being asked here is that the GT scores are being stuck, and we are not knowing what is the right amount, the number of rights. What are the number of rights that are good enough at this point of time? Is it 130, 140, or more than that?
This is GT scores on PW Med.
In any platform, sir, GT number of rights they are having between 120 to 140. Is that fine at this point of time, or what should they do to improve or or 120 is less according to you?
Yeah, see, it's on the lesser side. See, I would guess use GTs more for the answers that you're not getting. Try to find out what the answers to those are, and use GTs only for that purpose.
Yes.
Don't use your grand test as a conclusive inference that I am good or I am bad and compare with others. What is important for you is that when you take a grand test, if you are not able to correctly answer anything, then just use it to find out what the correct answer is. Use the GT as your driver of what your next week of studies is going to look like.
True.
And that will be the starting point. The ones that you get wrong, you will have a personal reason to find out the answers, because you're like, I thought I knew this. Where did I go wrong? And you start studying it. And
Yes.
that will drive your knowledge till your GT scores obviously improve. There is no I know we human beings look for very black and white answers. If I get 140, if I get 160, if I get this much, then I am safe. You want very quickly that reassurance. Trust me, that reassurance basically doesn't mean anything, because the algorithm can pick up any set of questions. There
Yes.
is really no way to say that to make you feel better. But what these grand tests can do is they can tell you what you are not good at
Hmm.
and give you a starting point for your next week of study plan.
Yes.
And
Yes.
only that it should be used for. Don't
Yes.
worry about your marks if it's adequate or not.
Exactly. So take that point into your mind and prepare likewise. I think it's time that we are ending this session, sir. It's really lovely talking to you, having all the questions put up, and you giving so much clarity to the students. Thank you so much for being here, sir. Any last line or a word that you would say to NEET PG aspirants in your style?
Yeah, I always believe, like, see, I always believe that, you are not, I think you give too much importance to one thing because of people around. And I can tell on behalf of the medical fraternity that we are the ones who put things like just MBBS. We are the ones who put things like, you will not get jobs if you don't get into PG. But when you go out, right? I've been practicing. I have worked in medical colleges, government hospitals, corporate hospitals, and private clinics. I'll tell you that except for 10 to 15% of patients who are, generally cranky about everything, the vast majority of 85% of patients just want a doctor who can listen to them, wants a doctor who can give them the right, truthful, and trustful direction and treat them. And you have a huge opportunity to address 1.4 billion of such patients, and you're already a doctor. Don't undermine yourself. Don't think you are just MBBS, you're good for nothing, and only PG will give you that golden solution. At the end of the day, if you take PG, you'll again be at the bottom of the food chain in first year, second year, carrying reports
Yes.
and running around here